Hi everyone, welcome to Question AI video. A client was admitted for an acute exacerbation of asthma. Auscultation findings reveal nearly absent breath sounds, and an albuterol nebulization treatment was promptly administered. 30 minutes later, upon auscultation, the nurse hears diffuse inspiratory and expiratory wheezes throughout the lung fields. This finding means A. There is increased airflow. B. There is no improvement in the airflow. C. There is worsening of the condition. D. The airflow issue was not addressed. Want the full explanation? Check out the details below for the complete answer.